My name is Keisa Wilson. I'm an education coordinator for the 5G medical unit as well as the hospice unit for Emory Healthcare. One thing that my colleagues did come up with as a group, they came up with this idea for warm zones. So we call it the warm zone model. Essentially what this warm zone model has done for us has helped us reduce our amount of PPE usage. We've seen a flattening in our curve for PPE usage, and we also used it as a way to keep our nurses safe. You have to touch in order to take these things off. So in that turn, it increases your risk of self-contamination because you potentially are putting this virus on yourself. The hot zones are considered the patient's room. Those areas are considered the areas where you would expect to have the virus around in the room. The warm zone is outside of the patient's room, so we have these areas taped off where they're visibly marked. Prior to the warm zone model being implemented, nurses would have to, so if they had a patient load of 6 patients, that nurse would have to take off and put on PPE 6 times for each patient room that they would have to enter and exit. But with this warm zone model, we're using a buddy system. So you have a clean buddy that's able to give you items, give you medications for each of the patients. So now that nurse would only have to don or doff PPE once, whereas before that would be 6 times. It's just as safe, if anything more safe, because you're not having to take off your PPE as many times. This was just an idea. It was just a thought, and we just saw what was happening with our PPE, and we saw what was happening with our nurses, and then they just came up with this idea, and to see it actually work has been amazing.